Mr. Meyerstein, a retired stockbroker of Danton Green, Kent, took his place for the first time on the board of the Middlesex Hospital on his birthday. This gentleman, who recently subscribed £100,000 to the hospital, proposed that he gave himself a birthday present. And what he wanted was this appeal board. So he bought it from the hospital for £85,675, the amount needed to close the reconstruction fund. Now the job can go forward without any further worry about where that last bit of the necessary £1,200,000 is coming from. A generous gift, one which will be appreciated not only by the hospital board and staff, but by the thousands of people who benefit annually by the treatment they receive in this wonderful institution.
In the prosaic words of the London Gazette, Sister Dorothy Louise Thomas was awarded the gold medal for an heroic and self-sacrificing action in averting a catastrophe after an explosion in the main theatre at the Middlesex Hospital. She herself is too modest to speak, but we're going to tell you how one morning the valve of an oxygen cylinder in the anesthetic room was being changed when an explosion occurred. The oxygen caught fire. Sparks and flames shot through the open door of the room across the theatre for 15 feet. There was a terrible fear that it would explode. The theatre was immediately vacated. She stopped behind until everyone was safe, then removed the ether from the anesthetic room and shut the doors to minimize the effect of the explosion, which she expected at any moment. Then, even after all that, she re-entered the room and turned off the tap of the cylinder. Seldom has there been a greater and more noble act, and we pay honor to one whom the King delights to honor.
Night empties the city streets. The crowds have gone home. The traffic is still. But through the darkness cut the headlamps of a car, an emergency ambulance speeding to a hospital. For while you sleep, another side of the city is wide awake. Men and women who dare not close their eyes. The oldest alarm in the world has gone out. A life is in danger. Outside in the street, human beings are shadows. But inside the hospital, the operating theatre is a blaze of light. This is the no man's land of a battle for life. While you lie in bed, a man will be lying on an operating table, sleeping the sleep of anesthesia, unconscious of his part in the drama of surgeons and nurses intercepting a call from death. The surgeon is the general conducting the battle. X-rays are his maps of the enemy's forces and emplacements, the slender intelligence enabling him to plan his campaign. Assistants and nurses are his army, quiet, deft, unhurried. Over the patient, now immune to pain, drops the curtain of oblivion. His body is the battleground, and these are the surgeon's weapons, weapons against an enemy unseen. This is 0 hour. Now the battle is on. Death, the opponent, has already begun the attack. He chooses his own time to strike, daylight or darkness, observing no hours. Night is his friend. The small hours when most men are off their guard, when human resistance is at its lowest ebb. And so this other world within our world exists, peopled by skilled men and women who wait through the darkness to meet the challenge whenever it comes. They fight in silence. More light needed, but the instruction from the surgeon never needs to be uttered. Nurses are the general's other eyes, watching the battle as he wages it, knowing in advance his strategy, anticipating his tactics. The battle reaches its critical stage. To live or to die. To see the sunshine again or remain forever in darkness. Even the surgeon knows that now the issue is out of his hands. He calls for a blood transfusion. Victory. But their faces show no sign of triumph. The presence of death has been too close for exultation now. Here in the theatre, the drama is done. Outside, dawn is breaking. Life begins again.